good morning, afternoon, evening, if you're watching the replay, wherever we may be. I am Andrea Clark Horton, Director of the Perinatal Mental Health Alliance for People of Color, and this is Coloring the Conversation on perinatal mental health. Thanks for everybody for tuning in. I am really excited about our conversation today because I think it's a topic that we really don't talk about enough. And we're talking about sex and sexuality during the perinatal period. And I have some great guests with me today. I'm going to let them introduce themselves and tell you a little bit about who they are, what they do, and then we'll jump into the conversation. Okay. So, first, I'm going to start with Jessica.
Hi, my name is Jessica Van. I am a licensed professional counselor here in South Carolina at my own practice in Vision Counseling, where I meet moms at the intersection of parenting and maintaining intimate relationships. So I specialize in sex and relationships and helping moms to overcome birthing traumas to get back in their body.
Yeah, I like that. Hey, all right. And we have Dr. Fisher.
Thanks for having me. I'm Dr. Sheehan Fisher. I'm a clinical psychologist, actually perinatal clinical psychologist, and also professor at Northwestern University. So my specialty is focused on both moms and dads' experience during the perinatal period and how that impacts the child, and do this work nationally and also internationally.
Wonderful. So y'all see, I brought the folks to know what they're talking about, right? But also folks that I know that are gonna keep it real with us and completely honest, right? And so I want to start by just talking about what are the most prevalent challenges in your experience in working with families around this issue. What are the most prevalent challenges to intimacy, either during pregnancy or during the postpartum period? Dr. Fisher, we'll start with you.
Well, one thing is just I think this topic is just missing usually from training and also just from the conversation. So I was so happy that you included it because it's something I am passionate about, that we don't talk about sexual health, especially in the US. We're so taboo about sex in general that even within medical settings, we tend to leave it out of the conversation. But we're talking about perinatal health, like this is obviously how children many times come to be, and we need to make it part of the conversation. So when we're thinking about this, I think that one of the things that is missing is just during pregnancy and throughout the postpartum period, we don't really assess and understand what is the mom's experience. We sometimes even make assumptions about it, and a lot of that many times is gendered assumptions. I've had patients where they talk about their sexuality and their desires much higher than their partner, but then we don't necessarily look at it that way. We kind of make assumptions about who will be interested or not at different phases of the perinatal period. So I think we need to, one, just make room for the mom to be able to talk about it, and especially not only during pregnancy, but even postpartum, for her to get back to her normal self and her life, and trying to adjust with so many biological and physical changes that does impact sometimes how they feel about themselves in relation to their partner or just even their own sexuality in general, and how that might change over time from the postpartum period all throughout the child's lifespan.
Mm-hmm. Yeah, Jessica, do you have anything to add to that?
I was just going to say all of that. And we often forget that because someone is become pregnant does not mean that they have a strong grasp on sexual intimacy and where it all starts in the brain. So there's all these changes happening to them mentally and physically, and no one's having the conversation. For me, a lot of times what I see is the effects after having a baby. So in the postpartum period, where there's been a lot of physical changes, or maybe they've had a traumatic birthing experience, and so having the fear of even becoming pregnant again is something that blocks that sexual desire and the ability to have fulfilled sexual experiences.
Yeah, that thank you. I was thinking about the conversation I was having. I'm doing my clinical training right now. And conversation I was having with the mom who recently gave birth, and she said, I wish my doctor would have told me, that my body was going to be different. You kind of say 6 weeks after birth, you know, you can go ahead and start trying. And I wasn't prepared for how physically painful and different that's going to be. And so what that does to my thought about this thing that I've come to identify as a really big part of my self, my womanhood, being affected in this way. Like, do either of you have any tips for like what could our medical professionals be saying or helping new parents with in terms of ho- what they can expect in terms of the adjustment and how things are going to be different? Dr. Fisher.
Well, I appreciate you mentioning that because I think, I mean, in general, so often I'm working with moms and they're talking about how betrayed they feel in general about what they did not know was going to happen during and after pregnancy. Like such
Yeah.
a, it's still a concern that we don't do enough of psychoeducation to moms and birthing people about how their body adjust, all the different possibilities, not to scare them, but say, hey, these are things that can potentially happen and not leave anything off that list, which also includes sex life. People talk about sometimes after having a baby where sex can be very painful. They weren't informed that that could be a possibility after delivery, or just even their choices around the type of delivery you want to have and what that has implications for their sexual health. So it should be incorporated in the conversation versus it being, I think, almost like viewed as like this little add-on that's not really essential for your overall health, but sexual
Mm-hmm.
health is a part of your medical health.
Mm-hmm. Jessica, you want to say it?
Absolutely. And a little bit of a shameless plug, but I think it's so important. I am the founder of a maternal health nonprofit where we seek to educate mothers about these things in birth and bodies, about how they will experience these changes. I know personally, one thing I didn't realize is that there's pelvic floor therapy, which is so important after
Yes.
giving birth to a child. You need to kind of relearn your body and relearn the way that your muscles work. And so I think that it's important, again, to have those conversations about what will change, and keep in mind, this is not like a scare tactic to keep you away from having children again, but we have to know the good and the bad, and in order for mothers to be able to be their best selves.
Right. I think betrayed was the word that mom used when she talked about like nobody told me, and
Yes.
nobody told me that I was also, nobody talked to her about the fact that, she might, her mood, of course, everybody talks about you might be sleepy and you might have the blues for a couple, like that's all normal. But nobody talked to her about the high levels of anxiety that she would have, postpartum, and then how feeling different sexually adds to that, added for her, added to that, like that feeling of anxiety, that feeling of depression. Um, and so, how do mood disorders, like what we call perinatal mood disorders, how do they affect sexuality during the perinatal period, Jessica?
Again, it's important to realize that everything starts in the brain, and so we have to make those positive connections. And the first thing, in order to be able to make positive associations, is to know that, to normalize it, to say that it is normal to have some anxiety, to have some depression after, because there is a little bit of grief that comes along with having a new child. Your life looks different. And so these perinatal mood and anxiety disorders impact women greatly, because it kind of cuts them off from the things that they once found important. Now that looks like that has to change. You just have to reorganize and reprioritize things. So letting them know who they can have these conversations with, who are the experts, and having those resources available at postpartum appointments, seeing a mom before 6 weeks, right? Like a lot of times the baby gets seen, but then we are told we have to wait 6 weeks to have an appointment. And so, who can they talk to in that 6 week period is going to be important.
Yeah. Dr. Fisher, do you think it's the same thing for male partners or the non-birthing partner? Like, how do PMAS potentially affect the sexual health of the male partner or non-birthing partner?
Yeah, I think that similarly, like I think both of them are going through a big life transition, like many times for the first time, trying to adjust to the different level of stressors, responsibilities, the conflicting responsibilities too, for like these even just the time. and especially adding in the sleep deprivation, all those things definitely can have an impact on the person's sexual health, their desire, their even functioning. And these are things that are not necessarily always discussed on both ends for birthing and non-birthing parents of what that does to the person. And we also have everyone's different too for when they're under stress, what do they want? Like sometimes people want space or want to relax. Other people want to have more affection or connection or even sexuality. It really depends on the individual. But even we're talking about this even in the medical setting, but even within couples, they don't talk about sex. They don't actually talk to each other about, I mean, that even before committing, before even having the kid, much less once a child is in the picture, hey, what is your actual baseline sexual desire? Like, I think I was doing some consulting for a public health organization a couple of months ago, and that was a conversation where we make assumptions about it, but people actually don't really have a conversation about, hey, what is our compatibility around sexual desire? How do we bridge that gap? If there is a gap, how do we address this as life transitions start to occur, having a child? And so it should be like an ongoing part of our conversation. But even with the person you are intimate with, many times people still feel it's taboo to bring it up or feel like either they don't want to feel bad about themselves or don't want to offend the other person. And that actually leads to, when I do couples counseling, issues way later that could have been addressed if they had talked about it earlier on.
Yeah. Yeah. I'm thinking about also how do kind of dominant cultural narratives and ideas about who can be sexual and how sexual and what that means. So if I'm a new dad and my mood and my sex drive have been, changed, either diminished, like,
Mm-hmm.
these dominant kind of ideas about masculinity,
Yeah.
can drive like how I feel about talking about that with anybody,
Yeah.
especially with my partner.
Yeah, I would add to that, like, especially a lot of the work I do is around like gender norms and even just gender rights and equity. Like so often I see this, and especially in clinical settings, men perform masculinity, like they might perform that they're
Mm,
really sexual. There are so many men who are on the spectrum, including those who are asexual, but they would never admit it because that means you're not a man. So prior to
mhm,
many times getting married, they might try to portray this way, but then once they're actually with their partner, I've had quite a few cases where the wife or partner was way more into sex than the male partner, but it was like almost like an issue, but he would feel offended to point it out, and that leads to a lack of communication and be able to address the problem. So I think we put that pressure, and on the opposite end, we tell women that they can't be sexual, they can't like have a strong sexual desire, or more problematic, that sexual desire is in reference to the man versus being their own, which then also makes it limited for how women feel
yeah,
the right to explore their sexual desire or even to be able to communicate about it in an honest way.
yeah,
Right. And this is what we call sexual scripts. Our sexual scripts, what we were taught about sex, what we were not taught about sex, what society says us about sex, it plays a great role. And so it does change a lot. And again, no one knows who they're supposed to talk to about these things.
hmm,
I guess, like, generally for men, their manhood is attached to their sexual prowess. And so if they've got reached a point where, like, kind of empathetically they're experiencing that testosterone drop and they're not interested in sex, they have no idea where to go, because it technically isn't a medical issue, because it's more of like an empathetic connection with their partner. So it those roles play a big have a big responsibility in the sexual conversations that are being had amongst couples. I just actually had a workshop with married couples who had been married for 40 years and never had conversations about actual sexual desire, and the gap, how that may change the discordance on someone has a high sex drive, someone has a lower sex drive. And it's just amazing. 40 years and 3 children, and you've never had a conversation about what this actually looks and feels like for you. It's interesting.
I want to
child,
ask Jessica's point, like especially around the idea of masculine views of being sexually, like the sexual prowess, is that, even once think about the spectrum of sexual health and the perinatal period and just becoming reproductive health, is men don't necessarily always want to get a vasectomy, and they don't realize, one, just for their own health and their desires for family and family planning, but also, there's no hard data on this, but here anecdotally about how women feel more comfortable have sex when they know it's safe. Like, you know what, I don't have to worry about getting pregnant. I don't have to worry about there's a risk, and therefore that actually leads to more sexual desire because you actually can relax and or
Mhm.
not to take medication or not make birth control themselves and the impact it has on their body. So even we're thinking about when they're deciding, hey, you know what, we don't want any more kids. Are they talking about how do we think about sexual health in an equitable way that who
Mm,
would take that next step toward it? And what
mm.
are the
Yes.
implications, including increasing sexual desire on the behalf of both of them if they know they can actually do it safely without the risk of a pregnancy?
Yeah.
And that's what doctors aren't talking about as well, the medical
Exactly.
implications and the difference of like an outpatient surgery, such as a vasectomy, and then having like full on, um, anesthesia, epidural to have like a tubal ligation. And,
Exactly.
it's more attached to it just than just your gender identity.
And the
Yeah.
gender bias in that and the pressure is just unfair still.
Yeah. I was going to say, listening to the both of you talk, I'm thinking about these checkpoints that new birthing parents have, right? Especially if I'm the one, if I'm the one that gave birth, I have to go and have a checkup at 6 weeks postpartum. I agree, Jessica, it should be earlier than that, right? But at the baseline is like 6 weeks, but I'm going into the room by myself, right? And so if I have a partner who is the not the person who gave birth, where do where's the responsibility for someone to check in on that partner too, right?
Mhm.
To ask them questions about how they're feeling and their own if they're having those kind of frustrations around their sexuality and sex not feeling the same or not being the same or not being as motivated, the drive being lower. Like if I'm a partner who is not the person who gave birth, if I'm the male partner or the non-birthing partner, like who's checking on me? Who's doing screenings for me? Dr. Fisher, have you ever heard like who
No.
who checks in on the non-birthing partner?
This is a failing of the medical system because we always work based on identified patient. We're, American culture, we're very individualistic. We work with one person. Clinical is very one person. We don't really take a community approach to things. So, of course, the OB-GYN, they're focused on the birthing parent, and that's rightfully so. They're doing a little bit more now to think about, screening for fathers with depression, things like that, but not a full conversation. Same thing with the pediatric setting. Unfortunately, it's usually the mom who comes to it, and therefore fathers are starting to come more often, but once again, not necessarily, there is no like actual dedicated space for the non-birthing parent in general of, okay, when I have a baby, where do I go for resources throughout the whole thing? Like there's some, one-offs of like different classes and other things, but not really thinking about, hey, you both are having a child. One person, of course, is carrying the child, which is definitely more of the medical intervention and support, but not necessarily a place for the psychological transition for this other parent to have a place to go to that's actually stage-wise engaging with them to ensure that they're having a smooth transition.
Just you asking that question really made me think, wow, this is something that has gone greatly ignored because, yes, the mom needs to be seen sooner. And when you take the baby into the pediatrician's office, all you get is this the Edinburgh scale, and they do that and they don't even follow up on what the mom says about it. Then you have the non-birthing parent who is completely ignored in the whole situation. And when you were asking the question, I was thinking it's important to have a conversation as the birthing parent and also kind of check in yourself with that parent. Like, hey, what is it that you need? But we often forget that because we're going through our own changes. I wonder, Dr. Fisher, do you think those services would even be utilized by let's say male parents, like who again, that is tied directly to how they see themselves as a man?
Yeah, I think that they would be, but it takes work. I look at it like any different thing. It's just that when you're trying to engage with a population, you have to make sure that you've done the legwork to get them there. So like
Mm,
just like when you think about people like, oh, let's focus on Black population. But if you don't have a good relationship with the community, if you don't have any engagement, it takes a while to build that up. So I think fathers are interested in getting services, but we do have to like do a lot more on the back end around the culture, around how we engage with fathers in general, how much they feel included, how much they feel responsible for the next stages of this life phase, to
Mm.
then make sure that they would utilize it and not feel there's different barriers like feeling shame or feeling like they don't have time, or even like we don't have parental leave, so we don't have time to get off from work to do it. So there's a lot that would need to be done to make it successful. But I think there is a need there that men do express, but they do also feel like, do I have the right to need something around this time? Should it even be about me because society says it shouldn't? So it's a balance, a complex answer to that.
Yeah. And I heard that in the when I worked as a chaplain, and I did a lot of work with parents experiencing loss, or the babies in the NICU, right? And so I heard a lot from the male partners, especially, like, not having that space to talk about their own grief and their needs in that moment, because they're worried about taking care of the partner who gave birth. And so, right, kind of even having the conversations, I wonder what it would look like during the prenatal visits, if partner came along and the OB is normalizing kind of from the early stages of the pregnancy, that there are going to be shifts that happen for both of you,
Yeah.
right? And not just focusing on the birthing parent.
Yeah, I have developed a whole protocol around this where usually if I'm working with a mom, I bring in the partner and we have a whole long discussion about various topics, including about sexual health and the changes, and trying to encourage them to be able to communicate those changes, because they're trying to make sure they normalize that these things will happen, but also making space for it so they can actually figure out what do they want to do about these changes for both of them as it occurs. So I think it is something that would be good for them to, for fathers to be a part of some of the conversation, not to take over, of course, the appointment, but have a space where it's available where they can talk about this in a more proactive way versus not only reactive, but many times like once things get really hit the head, then people are coming into it. But many times it's not too late, but it's getting close to that point.
Yeah.
Absolutely.
I didn't know if you were going to add anything else to that, Jessica.
I'm over here feeling convicted, so I have to get with Dr. Fisher so that I can start to implement that protocol, because often the non-birthing parent is ignored, and it is a system, and so we need to treat the whole system. So nothing more from me on that.
Um, for either of you, have you seen that it to be the case that sometimes during the pregnancy, before delivery, as a birthing person's body is changing, are they experiencing a different kind of connection to their body, disconnect from their body? I know for a lot of folks, the thought is that I know how I got pregnant, right? But a lot of times is that now I am starting to have this identity shift into motherhood, and that shifts some of my kind of understanding of myself as a woman, or a, 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 a sexual person, away from me. How is have you found that to be the case? Do people struggle with that sometimes, and how do you help to either normalize that or help people navigate through that, Jessica?
I've seen this a lot, and it's definitely on a spectrum. You have someone who has immediately kind of accepted the role and really gotten comfortable with their body, and then you have others who are like, "This does not feel natural to me. This doesn't feel like who I am." Then you have like the expectations of society of what motherhood is and what it looks like to be carrying life. A lot of times, what I would suggest for those individuals is, let's have a conversation about how you want to experience this journey. Let's have a conversation about where you want to go and what it looks like for you. Because a lot of times we think we evolve into these roles when in fact we get to create them.
Mm.
We get to say, this is what parenthood looks like for me, and this is how I choose to experience it. And I really get excited about it, and try to help my clients to get excited about, look at the opportunity that you have. You don't have to be the same type of parent that came before you, the parent you came from. You get to create parenthood. And so I think just sharing that this is your journey and you get to do it the way you want, can really make it an exciting time.
Yeah.
Yeah, I would add to, like, when you said even the word motherhood, like that is the thing that it's impactful because it's a loaded term. Like when you say, "Oh, it's transition to motherhood," that's such an socially imposed view of what that means. And so often I've seen that where moms will talk about where, well, I'm a mom now, therefore, am I allowed to even be sexy? Am I allowed to have sexual desire? Am I allowed to even want to dress and act a certain way, because not because of anything biological, literally it's socially imposed of, do I have the right to my own body? Like in
Mm,
general, think about the policies that have changed and like political aspects where women don't always feel, many times don't feel right to their own body. This is another phase of it. And at the end of the idea of the shame that's put around sexuality since childhood around many women, just doubles down on the fact of, you know what, I don't have the right to what I need. And then I'm also expressing that my body is changing and trying to figure that out, but doing that many times in a vacuum, not really feeling safe to be able to talk about what this feels like in relation to their sexual desire.
yeah.
All right.
Yeah.
And one of the things when clients come to me, a lot of times they say, I want to own my sexuality. And so I say to them, even if they have the language to say that, I say to them, okay, well, who has it? Who owns it now?
Yep.
Because that's where we have to start. We have to start um, letting our clients know, letting these people know you do have a right to all these things. A lot of my posts say hashtag moms do it too, because that's the way that we got here. We got our children here. And the truth of the matter is, you don't stop being a sexual being. Just as you came into this world as a sexual being, you don't stop being a sexual being once you create a life. And so that's where really where I stick is like, you have the right and you have the ability, and let's create. I love like coloring outside the lines. Let's do it.
Yes. And I want to add to that, like you're right, like who owns it? Because many times society, it's culture, it's the religion, and
Mm-hmm.
their partner before even they get the chance to have a space of owning it. So they have to find a way to separate from all those things. And what I see a lot too is that moms and dads in their own way start
Mm-hmm.
to be more aware of it once they think about their own kid. Once they realize that, oh, I'm raising this kid in my certain culture, religion, background, whatever it is, and do I want them to feel also the same way I felt, even around sexuality? That's to help
Absolutely.
them even think about for themselves, like, why do I also feel so trapped? But realizing they definitely don't want that for their own children.
Yeah,
Yeah.
and reclaiming negative viewpoints. You know, when I was getting ready to go out with a group of friends, and somebody said, "I look like somebody's mama." And what's wrong with that? You are somebody's mama. You too, somebody's mamas. And let's like kind of reclaim that. Let's redefine what moms, what dads, what parents look like, because we get to create something different. Y'all see, I'm big on creation. We get to create something different for our children and start creating safe spaces for them to come to us and tell us who they are, because they know long before we do.
And
Yeah.
I think I want to add to that, actually, even that because a lot of us are having children later, another part of it, especially the pressure put upon women, is about age. Like, okay, now that I'm older and
Mm-hmm.
also had a baby and now have a mother role, all these different things tell people that their sexuality is supposed to be diminished, when in actuality, like you said, like being like looking like a mom or looking like a dad does not mean somehow you should be a less sexual person or even have less sexual value.
Absolutely.
I remember thinking about the religious piece because y'all know I'm a pastor too, right? Because you can just have one job when you can have, why have one job when you can have seven? Um, so thinking about that religious piece, and I'm divorced, but thinking, one of the things that I know about black folks and other people of color in general, to make a broad sweeping generalization, is that sometimes we're going to go inside the faith community to ask
Mm-hmm.
questions before we'll go seek out help elsewhere. And so thinking about struggling with when things got tough in my marriage, and things got tough right around the time, when my son was in that 18-month-old period, and being really, trying to figure out what to do, and going to some folks inside the church, especially these are the folks that have been married 40 and 50 years, and asking, like, what, I really don't like this person that I'm married to right now. I'm really struggling to connect to myself as somebody who is, sexual because I'm looking at this. My son can climb out the crib and come into the room at any moment, but I don't even want to touch this person over here. And, it's kind of causing friction in our relationship, and being told, like, it's your duty as a wife. Like, this is how you get the man to do what you want him to do. This is how you make things smooth in your household. If you have sex with him, then he's going to be happy, then he'll do what you want. I've never had a message like inside my experience of being a wife in a Christian kind of setting, as we do all kind of marriage ministry, that talked about my pleasure. It was really how you use sex in a transactional way or in a way to manipulate, right? And that, especially once you become a mother, is out of duty, and not it's almost kind of like you're dishonoring your role as mother if you're getting any pleasure out of it, but you're also dishonoring your role as a spouse or a partner if you're not doing it.
That's like a rock and a hard place type situation. And when I gave my workshop, it was actually with the church, and I was so thankful for that church being open to allow me to come in to talk about sex and intimacy. And the thing is, I am a biblical scholar by no stretch of the imagination, but I do believe that our Creator wants us to experience pleasure. So I find I create a sensual lifestyle for myself through using my senses, and I encourage my clients to do the same. So what do you see, hear, taste, touch, feel? Is it pleasing to you? And it starts with what you put on in the morning. So when we're thinking about intimacy, we're thinking about sexual interaction, it is not about duty. It is not about performance. It is about pleasure. Pleasure is the point of the whole thing. And so I lead from what I call a trash perspective. So the trash perspective is thoughtful, rested, accountable, secure, and happy. I lead with thoughtfulness for myself because I teach people how to treat me. And this is what I encourage my clients to do. What builds your sensual lifestyle? And then discover that for your partner. And then the two of you share it. And you create it. Even in a faith-based community, it is, if that's where they're seeking it out, I want to start to infiltrate these places so that I can say it is about pleasure. Our Creator put us here to live life more abundantly, and that abundance comes from a place of pleasure. Exactly. And you can do that without harming yourself, without forcing yourself into this duty-bound or this performance-based relationship. It should be pleasing to you and to your partner.
And I want to ask that's what I was referring to earlier about the whole in reference to a man, like where sexuality for the woman is okay, well, making him happy or to get him to do stuff or to like you said, even manipulate, all these different ways where it's like, okay, it's not your own sexuality. Why is it only in reference to what he wants or needs, or for him to even do his responsibilities, I have to do this thing, versus really just trying to figure out for yourself first. And that also even comes to even self-pleasure, realizing, okay, how do I even understand my own body? What do I like and don't like? What do I need? And also to not feel so bound to the conversation. Sometimes moms have talked about where they have ideas about what they want in their sex life that might be outside the norm, but be afraid once going to bring that up because they're worried that, they shouldn't have a stronger kinky desire than their partner because based on the gender aspects of this. So these are things that make it so limiting, and we talk about it right now in the perinatal period, but we need to do this way earlier on when people develop their sexual identity, for it to be their own identity first and only before they even start getting it ready in their head as in reference to how other people are going to view me.
Yeah. And when you talk about having that earlier, before we even reach the perinatal period, we don't have to teach infants to be sexual. Now, this is kind of a hot take, right? They come into this world fully formed sexual beings. We are sexual beings. You can see it when you go to change a diaper, right? They know that if I put my hand in this place, this feels nice. And the way that you kind of guide that as a parent is you do not shame. You say, hey, you may have noticed that feels good, but right now our job is for mommy to change your diaper. And as they grow, time and place. This is your body, that you should have a right to explore your body, because that's how you learn how it works. And a lot of times, and especially Black culture, we don't know. You just don't do that. You just, everything, you wait until you get married. But when I
It's
get married, a switch doesn't flip. I don't automatically know how to use my body. So I tell clients, look at your body diagnostically. Touch your body diagnostically. If it bothers you to do it from a self pleasure frame of reference, make it for research, because it is important that you know what your body does when it's functioning properly, and when maybe something might be going on, so that you can report that and you can get it taken care of. So I think this conversation actually begins in infancy and should carry our children throughout their lives, so that when they get to the perinatal portions of their life, they know, hey, I have a right to tell my doctor when something's wrong. I have a right to speak to someone, and I have a right to, get the things done that I need for my own safety.
And
mm-hmm.
I would say, like, this is even, you said empathy, and even a little bit before, because one thing that's always made me angry, and I many times do react with anger when people are like, oh, when my daughter was even conceived, oh, you gotta get the shotgun. I was like, you're already telling me
Mm,
before she's even born that I own her sexuality, like before she's even here, and once she is even an infant, and even throughout her life, now she's 5 years old, people make that joke, oh, she's pretty, you have to get a shotgun. I'm like, one, that's just weird to say. Two, why are men so hyper focused on their own daughters' sexuality? Like, it's actually relatively perverted to me that men as fathers are so focused on their daughter's sexuality when that's their daughter
mhm,
who they should want to thrive in their sexuality. You want them to be a full human being, but yet our culture, our norm is that the man at that stage is not only in control of it, but wants to limit it. And then
Mm-hmm.
she's supposed to be a full human one day. And then men are almost shocked where they might meet a partner who's not very sexual, partly because she's already been beaten down so much about
yes.
being comfortable in her own skin.
I don't know if y'all are doing sound bites, but that's a word. Because if you let your daughter know, and your son, very early on, that you own your body, you
Yeah.
have the right to say no.
Mm-hmm.
And you have the right to say no when it comes to mommy. You have the right to say no when it comes to daddy. My son was very clear when it was time for me to get out of the bathroom, let him bathe himself, right?
Mhm.
And he's still a little funky, but we worked on it. Okay. So
Mm-hmm.
letting them do that is a part of their safety. It's a
Yeah,
part of their well-being, so that when they grow and they are in this phase of life, hopefully they've chosen to be in this phase of life and
exactly.
haven't done so out of duty or obligation. They made a conscious decision.
Yeah. Like you said, even for the boys, like for them not to think they have to perform and act like, oh yeah, I love sex, I want sex, I'm always into, sex all the time. Like that hyper masculinity is
Mm-hmm.
also taught on both ends, and everyone ends up suffering from it. No one ends up being happy from it, but we all feel the pressure to perform it.
and
Absolutely.
and the pressure to, like, so one of the things that is kind of a little bit frustrating for me is that we think it's cute that when we have kids kind of performing these adult
Mm.
roles, and so we start to tease little kids about having, crushes and boyfriends and girlfriends and that kind of thing. And my son is now 10, and so I think that, kind of the natural, like, developmental, space that he and his peers are in, like, they're starting to recognize things about themselves and starting to recognize and look at, other folks and find them attractive.
Mm-hmm.
And so my son, very blunt with me. We have a great relationship. I talked to him about the fact that I told him that I'm dating, right?
Mm-hmm.
And that he said, okay, I don't want to talk about this anymore. This is getting weird, mommy. I don't want to talk about it. But but what that means is that, I'm just getting to know people, and I would never, introduce you to somebody if unless they were very, very special and liked them a whole lot, right? And so then that led to the conversation about him. And, like, because I can hear his friends talking about, like, boyfriends and girlfriends, and I'm like, well, do you like anybody? Do you have a girlfriend or a boyfriend? And he's like, no, I don't like anybody, mom. And I'm like, okay, you can tell me if you do. Like
Mhm.
having that to be able. He's like, no, but I know my kids, so he's like, no, I don't. I said, does anybody have a crush on you that you know of? He's like, yeah, but it is what it is, and like
Yeah.
not making that a big thing, and
Yeah.
not pressing, because a lot of times we kind of rush to. It's just odd to me, like and you were saying, like, people talking about you having the shotgun, and like, oh, you get she's pretty, you're gonna need a shotgun to keep the boys away, whatever. But then on the other hand, like, I know folks that push these conversations about, like, oh, you think like when the kids are like 8, 9, 10, pushing the conversations about, oh, you think she's cute, you think she's pretty, or do you have a boyfriend, do you have a girlfriend, do you like anybody? Oh, that must be, you know what I mean?
Yeah.
And so on the one hand, we're teaching them that, encouraging sexuality, and then like saying that, but your dad owns your sexuality
Mhm.
until you, it's just
Yeah, like
weird.
letting them develop themselves for their own sexual desire. And like, I like the way you even said, like, you're interested to have a boyfriend or girlfriend versus sometimes we already, some who they're going to be attracted to versus like, hey, who are you attracted to if you have that conversation, like leaving it open ended so they can
Yeah.
discover for themselves versus already kind of like positioning your preference because they do want to please their parent. They do want you to be like them and to be proud of them. So even just some of the subtle language that we might use might already influence what we portray as acceptable or not. Because I've seen that also during the postpartum period where people kind of have a sexual awakening of like, hey, I never admit to anyone, much less myself, but you know what? I am not heterosexual, and it's a big deal because they could never, based on their background from the different cultural background, they never felt safe, honestly, to be able to
Mm.
talk about who they truly are. But now they're in a full relationship, then now they're expressing it, and of course that's hard because that person now has to figure out how do we navigate this when they're not really understanding kind of where they came from, but now knowing it, what do we do about it? So I think it's another part of it is not even predefining what that person's sexual orientation is.
Yeah,
Mm.
yeah,
That that is so good, and I think that that awakening that happens postpartum deserves a conversation. And I think it's important for us as the professionals to learn how do we even navigate that, because what happens if there is an awakening? Like, how do we ask the question
yeah,
without making it seem like we've assumed something, or I don't know. How do you say, what other changes have come up for you to kind of open that safety net? Is that something that I hear you saying, Dr. Fisher, that you're seeing that? So how do you open that conversation, or do they just come to you and are
So
open enough
it
to say
comes
it?
out sometimes just through the conversation. But one thing that one of my colleagues, Dr. Lisa Lappin Carr at Northwestern, and I are working on is creating an intake form that's actually more inclusive, not based on heteronormative views, but a broad
Mm,
one to make sure that just even when you do the intake, which is important, that you're actually making space to understand the whole person, their whole life trajectory, and the sexual health trajectory, so that when you're having the conversations throughout, it isn't already, once again, as the provider being already biased. We talk about this around even with OB-GYN departments where they automatically ask a woman, oh, what birth control are you on? Or have you been on birth control? And that woman might be lesbian, therefore not needing it. But their assumption is, oh, you must be having sex with men. Therefore, we're
mm-hmm.
going to ask this question. So these things sound benign, but it's already built into the conversation of how we do, even on the first day of meeting with the doctor, how that plays out for the bias that is playing into it. So we need to do our part to ensure as medical providers, how do we take our own bias into account and even look back at our measures, our intakes, our ways of treatment to ensure that it's actually being fully inclusive and not only perpetuating the problem.
and
Yeah.
that extends, I think, also to the decisions around, um, how you want to parent this person that's coming into the
Mm-hmm.
world, right?
Mhm.
And so, how do you, instead of asking, do you want to know the sex of the baby, right? That there's kind of like an assumption in that too, that you're gonna tell me the baby is male or female. How do we open a conversation with parents who may want to raise their child gender neutral, or have them to make that decision for themselves, right?
Yeah.
I think
Yeah.
it's important to ask open-ended questions like, what would you like to know about your baby at this point? You
Mhm.
know, and allow them to say, I'd like to know the gender, you know, as expressed here. Because science is so lazy. Science is so lazy to look at genitalia and say this is the gender of your child, and it's
Mm.
limited. So if you ask, well, what would you like to know about your baby at this point, then that kind of opens the door and again empowers the birthing person and the non-birthing parent to be able to say, this is what we want to know. And then they can make decisions once their child is in their arms.
Right. And also to be able for them to say this is what we want to know, but this is
Hmm.
what we want you to know as
Absolutely.
well, that we want you to know that we're raising our child gender neutral. And so we want for that to be part of the record so that when the child is born, we don't want an announcement of this is a girl, this is a boy. We don't
Absolutely.
want the staff that's going to care for the birthing person and the baby following the birth, like to put the pink or the blue hat on, and we don't want that, right? To be able to empower folks to say what they do want to their medical providers too.
Yeah, and I
Um,
think that applies. I think especially for thinking about queering our families applies to all of those and all individuals. Like even when my daughter was born, of course they put the pink hat on. I was like, I'm not, even though I'm raising her to be whoever she wants to be. Like, why are you deciding for me that she has to have a pink hat? Like, the second she's born, you're already genderizing her in a way that I
Hmm.
didn't approve of. And so it's really actually frustrating, like how much the messaging like plays throughout. Like we get bombarded by it to the point that's normalized, but it really, as medical professionals and even as scientists, need to think about like how are we taking. We science is supposed to be unbiased, but we are so biased because we as scientists are first in culture and how we actually engage in a medical setting.
yeah,
Hmm.
yeah. Switching gears just a little bit in the few minutes we have left, for those that may be watching, whether they are we have recently given birth or are pregnant, or they're working with folks who are recently have recently given birth or expecting, and they're experiencing in their relationship a disconnect, like they feel like they're off track. How do you help? What tips would you give? I heard I keep want to call you Dr. Sheehan, Dr. Fisher earlier say, communication and talking about like your wants, your needs, your desires, and all those things is key, not just during the perinatal period, but from the beginning of a relationship, right? But if we've fallen off track, what are some tips that you have for couples that or thruples or people involved
Systems.
in relationships, right? Relationship systems, to get back on track with their sexual intimacy, Dr. Fisher.
Well, I usually start with them knowing it for themselves. I think that's you want to kind of come to the table with enough information. So part of it might be whether on their own, whether it's in therapy or even someone that they trust, really thinking through like, okay, what do I actually want? And I always
Mm-hmm.
try to get them to think outside the box too, because sometimes we just already establish what's a possibility. Like you mentioned, like some people don't realize, oh, actually I am more polyamorous than I realized, but I just would never even thought about it because that's not societally supported. So really for them to take a step back and think about it and have a chance to be fully honest about their full spectrum of sexuality and desire. And then from there, of course, pointing out if it's safe, then have a conversation with their partner and lay that out. And especially though, for them to come into it with entitlement, for realizing they're entitled to their sexuality. They shouldn't come into it with a shame or if they approve it, if they're okay with it, versus like literally, I have the right to who I am, and I'm going to present this with a pride rather than feeling like I have to be a second to this person. And then also, which is the hard part, being open to that other person's response because you may not be sure what you're going to get back, and they might have their own views, their own desires, their own things that might be taboo for you, but at least laying on the table. And once again, everyone has the right to their own body. So it doesn't mean
Hmm.
by laying it out, we're all going to do all these things, but we can just have an honest conversation about what could we do, what can we explore, what things might be off the table based on everyone's own personal um, boundaries. And then even sometimes really having an honest conversation about compatibility. We're just trying to figure out, okay, how do we look at this honestly about it without any guilt or blame versus just this the reality of what it is. We laid the cards on the table, and now at least we know what we're working with, rather than going through what most people go through, is just kind of putting under the rug. Like I said, 40 years can go by and never have a conversation, but then there's infidelities, then there's divorce, then there's other issues that might come up, or just resentments that don't allow everyone to avoid them when it could be avoidable.
Yeah. Well,
Absolutely. And I think laying ground, like laying a space for these conversations to take place, like setting aside this hour is for us. This hour is for us to reconnect and having ground rules when we speak to each other. This is the way we're going to speak. This is, effective communication is difficult. However, it's a simple Google search on how to get started. And being able to say, this is the way we're going to speak to each other. I will have an opportunity. You will have an opportunity. And creating, kind of insulating yourself and creating a safe space. Think one thing that Dr. Fisher said is so important. When you sweep it under the rug, it's still in the house and it has to be dealt with. It's not going anywhere. So just facilitating that time and making it a non-negotiable,
yeah.
because connection is key, not just for the relationship system, but you're bringing in a life into that system, and they have a right to safety. And so those conversations facilitate that safety.
And I'll throw out there too, even sometimes I encourage them to make a game out of it. Like going
Mm-hmm.
back to like when you're a kid, like 21 questions. Let's like, because it actually makes it a little more lighthearted, it's a little bit less threatening, just to kind of, rather than have sometimes people can't handle the sit down conversation, but hey, let's just ask questions you would never ask around sexuality or other things, that at least gets the ball rolling to be able to even have the framework for a conversation later on. So
Right.
there's different approaches to it to make it palatable, but also realizing, as you said, it's essential because it is still in the house if you don't address it.
Yeah. They have all kind of little decks, card games and decks,
There's a
like
lot
for
of those
couples,
out there. Yeah.
right? Or board games where you roll a dice and whatever you land on the board, like you either,
Mm-hmm.
depending on what y'all doing, you either got to do that thing or you like a truth or dare for grown-ups, right? And so there are lots of ways to have those conversations. And I do, y'all actually want people to talk. I mean, don't, don't talk and take the sexy out of the sex.
Oh, absolutely not. Absolutely not. So, yet another shameless plug. I have an intimacy workbook, and it takes you through various exercises that you can do to increase your intimacy, to increase your conversation. And in there, there's some playtime activities. So, sensate focus. How do I like to be touched? How do you like to be touched? Giving and receiving to your partner, and making the pleasure the focal point. Like none of the activities in the book are about ending up in sexual engagement. It's all about the journey and building that excitement in the sexual response cycle. So that can be the main event. So the talking is sexy. The talking is something you can do all day to get to that connection, and building that and making it better for you.
Yeah.
And even highlighting that sex is not just about the time of having the act, like a lot, like especially learning each other about, how do you communicate throughout the day? Not even about sex, just how you communicate in general, much less even about sex. Sometimes guys can, talk about how they're really upset about not having sex. I'm like, but how would you be in the mood if you had to clean the house all day, take care of the kid, work full hours? Like, part of sexuality might be even just you doing your part in the home. Like, there's so many different things that plays into it, that, as I think you said with the acronym TRASH, where like part is like relaxing, like having the
Mhm.
conversation allows you to relax, and now you understand each other better, but also even understanding the breadth of what can be done to create a level of relaxation someone will be even in the mood to have sex will play into it, but you can't do that without that conversation first.
And
So,
that means being keenly aware of the roles and responsibilities of your partner,
Exactly.
because gender roles are a little switched at my house. My husband usually does the cooking and the dishes and things like that. So when he sees me at the sink, that's sexy to him. Because he's like, I don't have to do dishes. So paying attention to your partner and looking at where you can lighten the load, being able to like redefine what is sex. you get to have your own definition of that. It doesn't have to be solely penetrative or genitalia based. It can be the little things that kind of turn you on throughout. And
Yeah,
sometimes that starts the conversation.
right. And being open to, if this was what sex was for me before I got pregnant or before we had a child,
Hmm.
and now some things have shifted. That's why the communication and the talking is so important. And also this point that I think you both brought up of like being self-aware, right? Checking
Hmm.
in with yourself. Like, this felt good to me, but my body has changed. This might not feel great to me anymore, right? And that not meaning anything negative about you as a person. Is just the most constant thing in life is change, right?
Yeah.
Right. And
And for
being
your partner, because the partner doesn't take it personal. A lot of times they feel, well, you don't want me, versus, oh, that hurts, or that feels uncomfortable, or there's been a shift in my mood that has nothing to do with you. But once again,
right.
without communication, that partner takes it as a personal insult and maybe starts to get depressed or feel bad about themselves or feel resentment that's unnecessary.
Yeah.
And the perinatal season is definitely another opportunity to create and explore, because navigating your partner's body may look different. So that means you get to introduce new positions, you get to introduce new angles, new areas in the house. So there's a lot of like, make it fun. Everything doesn't have to feel like a chore. I am about pleasurable, again, creating pleasurable experiences and carrying that into every avenue of your life.
Man, love it. Any final words from you all about this topic about sex, sexual health, Dr. Fisher?
The last thing I throw out there that we didn't exactly discuss is even around the body changes, where I've seen quite a few times where there's not even communication about this. Like, sometimes the mom feels like, okay, my body changed, it doesn't look the same as it was before the baby, and therefore there's no way my partner can be attracted to me. But when we actually bring them in the room together, he's like, I'm wildly attracted to you. But right, that's another place where the communication breaks apart, where there's society-based assumptions about what the snapback body and all these things that a woman
Yes.
should be like, and that's the only way a man might find attraction, where that's not necessarily the case. But also empathizing that even if he is attracted, she still might not feel ready yet in her own body, feel uncomfortable, has to make an adjustment. But for that also to be a part of how they empathetically engage with each other around that topic.
Yeah, I think about this all the time when a guy says, I don't care about that. I don't care about your fupa. Like, let me grab that girl. It is not that, it's that I care about my
Yeah,
fupa, right? And
exactly.
so
Yeah.
how do we like navigate this together then, right?
Mhm.
And how can I be open for my partner to affirm me in ways that, you know, might make me feel good?
Yeah.
Yeah. Anything else you wanted to add to our conversation today, Jessica?
I just think it's important once again for us to go back to the autonomy and the ownership of one's body and sexuality. And Dr. Fisher mentioned earlier that just because we talk about it doesn't mean that we have to do it. And so I think that just opening the lines of communication and then being able to say, thank you for that. I'm not in a place where I'm comfortable with that, and how do we navigate it is definitely important, because autonomy, consent is sexy.
Autonomy and consent is sexy. We love it. For those that don't know, it is Sexual and Reproductive Health Week. And so this is why I wanted to have this conversation this week. It's the day after Valentine's Day. It's Black History Month. We getting all the things in today. And
Yes.
this has been a great conversation. Thank you, Dr. Sheehan Fisher. Thank you, Jessica Van. You both were amazing guests. This was a great conversation. I already saw somebody ask, is this going to be recorded so I can watch it again? So we love to see that. And thank you all for watching. You can see how you can follow us at the Alliance, Perinatal Mental Health Alliance for People of Color on Instagram. You can find us at www.postpartum.net. Go to the Join Us tab, and then you'll find us, the Perinatal Mental Health Alliance for People of Color. You can find more information about us there. We're also on Facebook, LinkedIn, My team, my communications team, does an amazing job of keeping our socials updated. So you'll find us there. I also want, for those of you who are looking for some support or some help, Postpartum Support International has a helpline that we have. We call it a warm line. English and Spanish people, they're waiting to talk with you and connect you with somebody in your local area who can connect you with resources. So that number is scrolling. If you are struggling, you're not quite feeling like yourself, or you're concerned about your partner or a loved one, you can call the Maternal Mental Health Hotline 24/7. There's somebody there to answer. Over 60 languages spoken, right? So you can call, but most of all, if you're in crisis, if you're feeling like you want to harm yourself, or if somebody who is close to you is feeling that way or making those comments, you can call 988. That's the crisis line, and somebody will be there to help you. Okay. We want to thank our guests again. And we thank you all for watching. Watch the playback as many times as you need to. We want everybody to be free. Black
Thank
History
you for
Month.
having us.
Thank you.
All right. All right. Thanks for coming to conversation with me. We'll see you next month.